You've got pain in your buttock that shoots down your leg. You searched it online, and now you're stuck between two answers. Is it sciatica or is it piriformis syndrome? I'm going to help you think through that, but first, I need to tell you something important. That question is a little bit of a trap because sciatica is not actually a diagnosis. Sciatica is a symptom. And once you understand that, the whole thing gets clearer. Sciatica simply means pain traveling along the path of the sciatic nerve. That nerve starts from the nerve roots in your lower back, travels through the buttock, and then runs down the back of the leg. So when someone says I have sciatica, what they are really saying is I have pain traveling along the sciatic nerve pathway. That tells us where the pain goes. It does not tell us what's causing it. And that distinction matters because a pinched nerve in the spine can cause sciatic type pain, but irritation around the sciatic nerve deep in the buttocks can also cause similar pain. So the real question is not, is it sciatica or piriformis? The better question is, where along the nerve is the problem starting? Is it starting up at the spine or is it starting lower down, deep in the buttocks? I'm Dr. Omar Ramos. I'm a fellowship trained spine surgeon. Spinal causes of sciatic pain are what I evaluate and treat every week. But part of a good spine care is also knowing when the spine is not the main problem. So today, I'll walk you through the clues that point more towards the spine, the clues that point more towards the buttock or piriformis region, and why this is one of those problems you should not try to solve from a YouTube video alone. Let's start with the first clue. Where does the pain begin? When the source is the spine, the pain often starts in the lower back and then travels down. People may say, it starts in my back, then goes into my buttocks, down the leg, maybe into the calf or foot. That pattern points more towards a spinal nerve root being irritated. Common causes include a disc herniation, spinal stenosis, or narrowing around the nerves as it exits the spine in the foramen. When the source is more in the buttocks, the lower back may be relatively quiet. The pain may feel like it starts deep in the buttock itself. Patients may point right into the gluteal area and say, this is where it starts. That can point more towards irritation of the sciatic nerve outside of the spine. People often call this piriformis syndrome, but I want to be precise here. The piriformis is a small muscle deep in the buttock, and the sciatic nerve runs very close to it. In some people, irritation or compression around the area can create sciatic-type symptoms, but not every buttock-level sciatic pain is truly from the piriformis muscle itself. Some clinicians use the broader term deep gluteal syndrome because other structures in that deep buttock region can also irritate the sciatic nerve. For a patient, the key idea is this. The pain may feel like sciatica, but the source may either be the spine or somewhere along the nerve outside of the spine. So clue number one is the starting point. Low back pain that travels down the leg points more towards the spine. Pain that lives mostly deep in the buttocks with a relatively quiet back points more towards a buttock level source because these patterns overlap all the time. So we layer on clue number two. How far does the pain go? A pinched nerve in the spine more often sends pain below the knee, into the calf, into the ankle, into the foot. It may come with numbness, tingling, burning, or an electric shooting sensation. That is because the nerve root is being irritated closer to the source before the nerve travels all the way down the leg. If a patient tells me the pain shoots past my knee into my foot, especially if there is numbness or tingling, the spine moves higher on the list. Piriformis or deep gluteal irritation can also send pain down the leg, but more often it is felt in the buttock and the back of the thigh. It may fade out around the knee. Again, not always, but as a pattern, below the knee symptoms pull harder towards the spine. And true weakness is especially important. If someone has trouble lifting the foot, pushing off, climbing stairs, or the legs feel objectively weak, that needs a real neurologic exam. Weakness can mean the nerve is not just irritated, it may not be functioning properly. That often points towards the spinal nerve being the problem, although severe sciatic nerve irritation outside the spine can rarely do it as well. Either way, weakness is not something to casually stretch through. That brings us to clue number three. What sets it off? Spinal sciatic pain often flares with positions or movements that load the spine or increase pressure around the nerves. Things like bending, twisting, lifting, prolonged sitting, sometimes coughing or sneezing. That cough or sneeze clue is important. If a cough, sneeze, or bearing down sends a sharp pain down the leg, that points more towards the spine. Why? Because that sudden pressure change can irritate a nerve root that is already inflamed or compressed. Piriformis region pain often behaves differently. It may get worse with prolonged sitting, especially sitting directly on that side. It may flare with hip rotation positions. For example, sitting with your ankles crossed over the opposite knee, that figure 4 position. Some people feel it when getting in and out of a car, rotating the hip, or sitting on a hard surface. That points more towards a buttock level irritation of the sciatic nerve. So the clues are, where does it start, how far down does it go, and what sets it off. Low back origin, pain below the knee, numbness, tingling, weakness, or pain triggered by coughing and sneezing, those pull more towards the spine. Deep buttock origin, pain mostly in the buttock and back of the thigh, worse with sitting or hip rotation, those pull more towards piriformis or deep gluteal irritation. But I want to be very clear. These are just patterns. They're not diagnoses or verdicts. The internet loves to turn these things into simple tests. Do this one stretch, press here, try this movement and you'll know. That is not how this works. And piriformis syndrome in particular is one of the trickier labels in this entire area. Even among specialists, it is debated. Part of the reason is that there is no single perfect test that lights up and says, yes, this is definitely piriformis syndrome. Usually we arrive at that diagnosis by ruling out other things. We check whether it's coming from the spine, we check whether it's coming from the actual hip joint, we consider the sacroiliac joint, we examine how the nerves behave. We look at the imaging in the context of the symptoms. That is what people mean when they call piriformis syndrome a diagnosis of exclusion. It is not usually the first label you should grab. It is the label that becomes more plausible when the more common explanations do not fit. And imaging does not magically solve this. A lumbar MRI can show a disc herniation or spinal stenosis. That can be very helpful, but a normal spine MRI does not automatically prove that piriformis is the cause. It mostly tells us what is less likely. On the other hand, a spine MRI can also show wear and tear findings that are not actually causing the pain. So the rule is the same as in the rest of this series. Imaging and symptoms have to be read together, never one without the other. Now, you may be thinking, does the label really matter? If it all feels like sciatica, does it matter whether it starts in the spine or the buttock? Yes, it matters, because the source determines the treatment direction. If the driver is a pinched nerve in the spine, spending all your time digging into the buttock muscles may miss the real problem. And in some cases, aggressively stretching an already irritated nerve can make it angrier. That is one reason I am not going to give you the one stretch for sciatica from a video. There is not one stretch for sciatica because sciatica is not one diagnosis. It is a symptom with multiple possible causes. If the pain is coming from the spine, the treatment pathway may involve activity modification, anti-inflammatory strategies when appropriate, physical therapy focused on the spine and nerve mechanics, injections in selected cases, and surgery only when the situation warrants it. If the pain is coming from a deep gluteal source, the treatment may focus more on hip mechanics, gluteal and deep rotator control, soft tissue irritation, seating modification, and targeted therapy. Those are different paths. And choosing the wrong one can waste time or make symptoms worse. Now, before I close, I want to mention the red flags. Most sciatic type pain is not an emergency, but there are symptoms you should not ignore. If you have progressive weakness, a new foot drop, numbness in the groin or saddle area, loss of bowel or bladder control, fever, unexplained weight loss, history of cancer, or severe pain after major trauma, that needs urgent medical attention. Do not try to sort that out with internet videos. So let's bring this together. Sciatica means pain traveling along the sciatic nerve pathway. It is a symptom. It is not the final diagnosis. The real question is, what is irritating the nerve? If the pain starts in the low back, travels below the knee, comes with numbness, tingling, weakness, or shoots down the leg with coughing or sneezing, the spine moves higher on the list. If the pain starts deep in the buttocks, stays mostly in the buttock or back of the thigh, gets worse with sitting, and flares up with hip rotation positions, piriformis or another deep gluteal source moves higher on the list. But none of those clues closes the case. The real answer comes from your story, your exam, and your nerve testing, your hip exam, and imaging when appropriate. The clues in these videos are meant to make you a sharper participant in that conversation, not to let you diagnose yourself from a screen. And that is the bottom line. Do not ask, is it sciatica or piriformis? Ask, where is the sciatic nerve being irritated? The spine, the buttock, or somewhere else? That is the question that actually moves you towards the right treatment. If this helped you clarify things, the next video in this series covers another common impersonator, the sacroiliac joint or SI joint. the spot where your spine meets your pelvis. And if you are not even sure whether your pain is coming from your back or your hip, start with the hip versus back video. I'm Omar Ramos, a fellowship trained spine surgeon at Twin City Spine Center in Minneapolis, Minnesota. I'll see you in the next one.